on FM. Save Blood Arena is a health advocacy radio program that focuses on voluntary blood donation and broader themes of blood safety and transfusion. The program is produced in collaboration with the Lagos State Blood Transfusion Service. My name is Dele, Agadumo, and I'll be leading discussions. My guests are already seated. Well, for those of you who have not listened to this program before, on this program we promote voluntary blood donation. We raise public awareness about the importance of safe blood for healthcare. We also educate you as a listener on the latest innovations and challenges in blood transfusion services, especially in Lagos. Today, we shall be discussing voluntary blood donation and sustainable development goals. Of course, Taiwo Oloko is here. I'm going to start from Taiwo today. How are you doing, Taiwo?
I'm good.
All right.
Good afternoon.
Okay. I'm getting a hum from the microphone, but we'll sort that out. You're welcome again to Save Blood Arena.
Thank you.
And, of course, I have two of my guests. Well, they are here for the very first time. They are from the Millennial Fellowship. First, I have Deborah Kohode. Is that correct?
Yes.
Fantastic. All right, welcome to Save Blood Arena.
Thank you.
And, of course, I have Ahmad, Tijani, Animashaun. You're welcome to Save Blood Arena.
Thank you very much.
All right, so both of them are campus director of the Millennial Fellowship, so we shall be discussing with them. But I need to take one or two updates. I have one or two updates coming in right now. And this one is from the Ebuteru Mongo axis. It's let's see, a better movement on the coverage by NEPA inward at Mongo, descending the coverage inward. And ascending CMS bridge to connect CMS Papa is set to be good. Descending the coverage inward Elegbata Mini Stadium, Ebutero Market, all in good shape right now. And descending from Carter Bridge inward Ebutero Market, Leventis through UBA roundabout to connect Ina and Outer Marina is also looking good. Slow movement is recorded on Broad Street by Balogun Junction to Akmongo underneath the bridge to connect Ofikanal Market and Oloko. For now, aside that, well, we have a negative impediment. And many of the Lagos Public Works are at Akomojo roundabout by GT Bank in Ward Dokwemo. They are working there, but it has no adverse effect on vehicular movement at this time. But we'll continue to keep you updated if there are changes in that along that axis. So, Deborah, let me start from you. Tell us about Millennial Fellowship. What is it about? What's the vision, the goals, the objective of the Millennial Fellowship?
Thank you. So, Millennial Fellowship is presented by the United Nations Academic Impact, which is the UNAI, and the Millennium Campus Network, which is the MCN. The aim is to convene, to challenge, and to celebrate students' leadership in social impact and advance sustainable goals. So the sustainable goals, we have 17 sustainable goals, which part of them is zero hunger, education for all, good health and well-being, which is why we are here today.
Okay.
So the visions is to bring out, to empower youth, to students, to build student leadership, to be able to use their innovatives, to collaborate with others, and to bring out the better part of them. There are a lot of youth out there that they want to, there's a problem in my surroundings, and I wish I could solve this problem, I could solve these challenges. The Millennial Fellowship is giving them the opportunity that, this your thinking, this your thoughts, this your mindset that you have. You can actually carry it out. You can actually plan yourself, and you can actually do a social impact for you. You can actually impact your community in the right way. So that's the whole purpose of the Millennial Fellowship.
Okay, so Ahmad, your Millennial Fellowship, your campus director. What campus? What school? What institution?
Lagos State University College of Medicine.
Again?
Lagos State University College of Medicine.
Okay, that's Lasucom.
Yeah, Lasucom Ikeja.
Okay, Ikeja. Yeah. So now, the Millennial Fellowship, is it spread across all campuses or all universities or just Lasucom?
So the Millennium Fellowship is a worldwide program.
Okay.
It is, as she said, it's presented by United Nations Academic Impact and MCN.
Okay.
Which is Millennium Campus Network. Mm-hmm. So it is a program that is recognized all over the world. Mm-hmm. We have several fellows from everywhere, all over the continent, even across other continents, from Europe, Asia, America, and I said it's a global network, really.
Okay.
Because there are people from several places, even from India. So it's not just a Lasucom initiative. It's an initiative for student leaders. So basically anybody from any university can apply for it. And then if you meet the quota and all of that, your campus gets selected to be one of the campus to host the Millennium Fellowship for that year.
Oh, okay.
Yeah.
Okay, so for this year, it's Lasucom?
No. So Millennium Fellowship is a program that is held like concurrently across all campuses.
Okay.
So there's like this year now, over 64,000 applicants were selected from Millennium Fellowship all over the world.
All right.
So just in Lasucom now, we are just about 50 something.
Okay.
52, I think. 26 from Kohode and Kohode B.
54.
26 now, 52. Okay. Yeah. 50. Then in Lasuojo, for example, they also have two cohorts with several number of fellows.
Okay.
There are people from University of Ilorin. There are people from, I don't know, anywhere, name it really, in Nairobi, Kenya, in Europe, the Nile University, so several other places. So you just apply for it as long as you are in a university at that particular point in time. You apply for it, and then when you get selected, your cohorts can your campus, so you can be selected to host some course members. So you can just be about between 8 to 20 in your campus. You have your sessions where you get trainings on personal leadership development, and then you go about your specific project.
Okay. So what's the criteria? You talked about she talked about projects, where you have projects around, within your environment that you want to change, but they have to align with the sustainable development goals. So what's your campus, for instance, which of the sustainable development goals did you target or are you targeting?
Okay, so you apply for this Millennium Fellowship individually. Okay. So you pitch in your own project. Okay. So it can be from anyone. But our own campus now, for example, there are a lot of people that have their individual projects. But this project we are doing, which is Project Red Hope, which is part of the Millennium Fellowship project, is targeting SDG 3. Okay. Which is good health and well-being. Okay. So for most fellows in our campus, they are really targeting SDG 3 because it's a medical school. So most people know more about health and all of that. Okay. But if you go to other campuses, people target several things like no poverty, zero hunger. Okay. Some people, they just want to teach people in schools, talk about quality education. Some is about climate, like all this beach cleanup and all of that, all this climate action, life underwater, life on land. Okay. So really you can advance any SDG you want. But majorly in our campus, most of us are advancing SDG 3. And for this project specifically, we are advancing SDG 3, which is good health and well-being. Okay. Yes, thank you very much.
All right, thank you very much. So, Debbie, what's the correlation or connection between the sustainable development goals you're targeting and voluntary blood donation?
Okay, thank you. So, like my colleague said, Ahmad, he said is under SDG 3, which is good health and well-being. So under SDG 3, which is good health and well-being, there are a lot of people that they have emergencies, surgeries, childbirths, and they lose a lot of blood in the hospital because we are medical students, and then we get to see some of them sometimes. And those people, because of unavailability of blood in the hospital blood bank. So they don't get enough blood at that particular moment, which some patients get to lose their life, and some ones that are lucky survive. So this is one of the challenges that we saw, and was like, as a medical students, a lot of people do not know about they can actually come and donate their blood and save another life, even if it's not their family or their community member, but they are people that they should be given chance to live again. So that's why we we came across this initiative, which is Red Hope. Red Hope is to advocate and also tell people to advocate on community health and voluntary blood donors. Like, okay, you want to volunteer your blood for people, you want to save life. Even a drop of blood can save another person's life, and you don't know who you are going to meet in the future that is going to be the one that will save the whole country. So that's why we came across Red Hope. And
so tell us about your upcoming blood donor drive.
So the upcoming blood donor drive is going to happen on Friday, which is 14th.
This Friday?
Yes, this Friday, which is 14th of November at our school volleyball court in our school campus. So
that's Lasucom.
So this is that's where would bring. We are partnering with LSBTS.
All right.
Lagos State Transfusion Donor.
Blood Transfusion Service.
Rather. So where we are collaborating with them, where they will help us. Will organize a small volunteer program where people will come. We have started publicity in our school campus already.
Okay.
Telling people in the campus that you're a medical student, even though you're not a medical student, you can tell your friends, you can tell your parents, people should come and donate their blood to save another person's life.
Okay.
Yes, and we've also done a webinar whereby we invited Dr. Oshikomaya, where she came to enlighten us about blood donation and the myths that are behind it. Because some people believe that if they donate blood, that is going to be used for rituals, and a lot of people are scared that they don't want to come and donate their blood so that it will not be used for something else. And so some people believe that if they come and donate blood, they are going to get another infection.
Okay.
And some people believe that that their drug abuse, that they cannot donate their blood. So she enlightened us a lot about that even though you drug abuse, that you can still tell people to come and donate blood to save another person's life. Even though if you feel like because you want to come and donate blood, you will get an infection. That's why it's a safe blood arena. That's why we are advocating on safe blood. Okay. Is where you get there would screen your blood is in front of the patient or in front of the donor that we are going to open the bags and the needle that we are going to use for the blood transfusion. And then it's also help people to know the illnesses that related to blood. Maybe you feel like you have enough blood, and then you come and then we'll check your blood percentage and you see that
it's not enough.
it's not the normal. So that's it.
So definitely all you're saying is that you're just reassuring people that when they come on Friday, whether they are students or they are not non-students, they can come on Friday, get more information, get their blood screened, everything they need, that they will be opened and shown to them that is brand new.
Yes.
It's not used.
And they should not be afraid.
Yeah, I get you. So, Ahmad, is this the first blood drive that Millennial Fellowship is organizing?
Yeah, so Millennial Fellowship Lasucom, this is the first one we'll actually be organizing, but hopefully we get to continue it and do it annually. Yes.
Okay. So have you donated blood before?
Yes, I have.
You have?
A couple of times. Yeah.
A couple of times.
Yeah.
So you're not a stranger?
No, not at all.
Your first experience, how did you feel with the needle?
I would say my first experience is not like everyone's first experience. I donated and I just went by with my day, and there was nothing really special. I just waited for a while, took water, and then I went out with my day, and nothing really happened to me. Yeah.
The size of the needle did not scare you?
Most people's experience, actually.
The what?
So that's actually most people's experience.
Oh, I guess.
And they go, they continue the normal activities for the day.
Yeah, I think the normal experiences don't get a lot of how will I say it? A lot of exposure like the bad ones where they say people faint and all of that. So that was like the idea I had of it before.
So the sight of the needle did not scare you at first?
It was big, but then I don't know. It was big, but I wouldn't say I was scared really.
Okay.
Maybe
you
had
a good person, who the presence of that person assured you of, of safety.
Yeah, actually, to a good extent.
I can imagine.
But needle was big.
Yeah, but I had to ask that question because we've had a number of young people on this program who have told us that the size of the needle at first, scared them. But the person that handled that, donation was quite calm and was able to assure them of, safety.
Yeah.
All right. So, tell us how can young people support this initiative? Because I'm sure that you may have come across some young people on different campuses who probably have not thought about, any of the sustainable development goals that they would like to get involved in. So what would you say to them, to garner their support for this initiative?
Just to get clear, are you talking about this blood donation drive?
Yes, and subsequent, blood donation drives that should be organizing.
Okay, I think this was one of the reasons we had the webinar to really enlighten people and advocate for safe blood donation, and to really enlighten them about the myths and tell them it's actually safe to donate, and then also emphasize the importance of this blood donation. So I think what young people can do really is to first of all listen to programs like this where you get to understand the importance of blood donation, make your own research, and also when you know about this importance, just reach out to people around you. If you reach out to 5 people, those 5 reach out to another 5 people, just tell them about the importance of blood donation and actually how much we need it in this country. I think it will go a long way. And also for our project, if you are around Ikeja on Friday, you can just come around to Lasocom and ask around where you can get to the blood donation, the voluntary blood donation drive, and then just help donate blood. And I think that's what young people can help us do. Advocate when you can, and also get yourself involved in these blood donation exercises too. There are also several blood donation centers in Lagos where you can go to and just donate your blood, just volunteer to donate your blood. I think these are the basic ways young people can actually help with this particular initiative.
Okay, so for Debbie, I'm going to ask you the same question but in a different way.
Okay.
For young people around, maybe they're not students of Lasocom, they're probably just in town for a bit. What would you want them to do for you towards this program?
Okay, so what I want them to do for me is to, even if they are scared of the needle, they should just come. They should come, and maybe their mind will change, their perspective will change. And even though their perspective do not change and they are still scared of the needle, they would have more knowledge about blood donation. And they will be able to tell others that, you can actually go to this place and you get to save another person's life. Your blood matters. You don't have to be a medical student to be an hero. Even you donating your blood, you can be an hero or a hero by donating your blood to people. So that's basically what I want them to do for me. They should help me. They should come. And also, while coming, they should bring somebody else along. And after that, they should also tell people about it.
As young people, you spoke earlier about the social vices, substance abuse, and that's disqualifying certain people who engage in that from being able to donate blood. What's your how would you tackle that? I mean, you're a young person. How would you tackle that when people like that show up and during the screening process, they are found to have certain, maybe 1 or 2 substances in their system? What would you say to them?
Okay, that's a little bit.
You're a medical student,
yes,
I guess.
Yes,
yeah, because you see, they may want to really donate blood, but because of that, the presence of a harmful substance, they may not be allowed to donate at that time.
Yes,
but they still want to donate. So if you find someone like that comes in, what would you say to the person? I mean, these are young people.
Yes.
And they want to be a part of the process.
Yes.
They may not be a part of the Millennial Fellowship,
Yes.
but they have an interest.
Yes.
But because of that presence there, they will not be allowed to donate blood maybe until after a certain time, if they're willing to let it go, so they can go through the what's it called, the maybe treatment or recovery process. But for people like that who show an interest in being a part of the program, what would you say to them?
Basically, we just do the counseling part.
Okay.
Well, we talk to them about the after the screening of the blood and everything. A small sample is first taken to screen the blood to know if it's safe to go ahead with the transfusion. So after that, we would know if there is any harmful substances in their blood that will not allow them to go on with the transfusion. So if that is noticed, we'll just sit the person down, counsel the person, and explain in details, okay, this is what we found in your blood, and this is why we will not be able to go ahead with the transfusion for now. So
transfusion or donation
for now. So I would advise the person, this is what you should do, this is what you should not do, this is what you should avoid for now. And we'll do follow up with the person, because we cannot just advise someone and then leave the person to go. We have to follow up to actually know if the person is actually willing to stop the drugs and or the harmful substances we found in the person's blood. So that's basically what we'll do.
Taiwo, let me come to you now. I didn't forget you.
Yeah, I've been itching to join the conversation, really.
I know. On
quite loaded today.
Very, very loaded. On SBA, one of the things we have always brought into the conversation is the prevalence of substance abuse, especially among the youth populace, and the fact that this is one of the reasons. This could be a reason most of them are not able to donate blood as they should. So, how can LSBTS do more to make sure that we have that? We have less of that and more young people donating blood. Yes.
Basically, I would just want to remind them that as young people, particularly those that may, have issues with substance use now, that they should be the brother's keepers. So what I mean by that is, you donating blood saves lives. So put yourself in the shoes of somebody that needs that blood. One donation, 1 unit of blood, 1 pint of blood
saves
3 lives. So would you rather 3 people die potentially, or are in pain, or are distressed, or you take care of yourself by using the drugs? So you have to do like an opportunity cost. It's better for you as an individual, because you could actually be the one that would need the blood at the end of the day.
Exactly.
And then you would want the blood to be available. And like we always say, it's always better and safer for the blood to be available before it's needed.
Yes.
It's not when it's needed and then everybody's running. It should be there before it's needed. Because if it's an emergency, the emergency is not going to wait for the blood to come.
Indeed.
So be your brother's keeper. Think of the larger good that donating blood can do, and make the sacrifice of stopping substance use so that everybody, including yourself, will be safer as a society. So that is the advice I would like to give those that may have issues with substance use. But you've raised one of the issues, like I said, is a loaded kidney today. You've raised needle phobia, what I call needle phobia. I don't know if there's a technical or a dictionary name for fear of needles. There probably is anyway, but I don't know the word. But we can call it needle phobia now. And what I would like to say about that is, it's like most phobias, or like all phobias, they're usually irrational. It's not based on the fact that the size of the needle of one needle is more painful than the other needle. No, the skin. And that's why we use experts and people that are well trained at the Lagos State Blood Transfusion Service. They're very particular about things like that. But the size of the needle is not good. The pain is not going to be different if it's a small
if it's a small or a big one.
And it's so that we do not have to keep piercing you. That's why the size of the needle, because you're going to go into a big vein, so that the flow can be fast and smooth. If you use a small needle and you want to get, 450 mils of blood, it's going to take more time. So that's part of why we're using the bigger needle. It's not about the pain. What we normally do, what we encourage people to do, okay, fine, the pain is not much. There's really no pain, just like a pinch. So it just pinches you and that's it. You don't even feel it after the needle is in. But look away. Don't look at, the venipuncture process.
Take your mind to a happy place.
Take your mind and look away, and in less than a second, the needle is in the vein. And the blood, and then when it's pulled out, also the same thing. It's not painful. And like I said earlier, like I always say, we train at the Lagos State Blood Service, so that blood transfusion service, so that we have the best people, the best hands. Whether your veins are big or small, eating or whatever, we have the best hands to take care of it. And then safety and quality is very key to us. She mentioned the issue of some people, the myths that some people have. Some people think they could get infections. No, you cannot get infections if you donate with Lagos State Blood Transfusion Service. Right. We use sterile products from the beginning to the end. In fact, the blood is kept sterile until it's transfused into the recipient. Okay. So that is because, we always say, we say vein to vein. It's supposed to be a closed system. Yes. From one vein to the other vein. Nothing is not even hair. Air is supposed to come into that system. So, and we're very particular about such at the Lagos State Blood Transfusion Service. Thirdly, I'm excited that we have young people coming up with these initiatives and willingness to partake in voluntary blood donation and advocacy for blood donation. Right. That means the future is bright. We're calling on more young people to join the bandwagon. Okay. Nigeria has a population of about 200-something million, and we have not met our quota of voluntary blood donation. Most of the blood out there is people paying and all that stuff and being coerced. We can do it. Smaller countries in Africa have done it, where they have 100% voluntary blood donation and everybody is safe. Voluntary blood donation is the safest source of blood because the donor is not forced. He doesn't have to hide any information. He wants to do it because he or she wants to save lives. And also, females can donate. Just go there, we'll check your blood level. If it's within the donation range, we'll, ensure that it is safely done. Okay. Thank you very much, Taiwo. Debbie and Ahmad, thank you very much. Final word, just 30 seconds for Friday.
Okay, so I want to tell everybody listening, for anywhere, any part of Lagos that you are, please come out on Friday.
What time?
10 a.m.
10 a.m. Okay.
Till mommy calls.
Okay. All right. Ahmed, final word.
Okay, on Friday by 10 a.m. please come to Lagos State University College of Medicine to donate blood. And if you are not available, please look for any other blood donation center and please then to donate blood. Okay. Thank you very much.
Thank you very much. All right, so we have been speaking with Ahmad Tijani, Animashaun, and Deborah Kohode. Both of them are campus director, Millennial Fellowship. I've been discussing voluntary blood donation and sustainable development goals. You can get, they said, Friday, be at Lasocom. Just ask anybody for the volleyball court, and then you'll be directed there so you can be a part of the voluntary blood donor drive. For the LSBTS, their Facebook page is Lagos Blood Transfusion. On Instagram is Lagos State Blood Transfusion. On X is Lagos BTS. A telephone number to which you can send a message is 0806 920 7914. Big thanks goes to Victor Terry, executive producer Taiwo Akole. Not forgetting the executive secretary, Lagos State Blood Transfusion Services, Dr. Bodori Oshikomaya. My name is Dele Agadumo. Enjoy the rest of your day. Save Blood Arena comes your way Mondays at 4:30 p.m. on Lagos Traffic Radio 96.1 FM.